Hey guys, welcome back to Snippets of Sin. And today I've got a special guest, Ezekiel, Dr. Muchini, who's going to be kind of sharing a little bit of knowledge with us about this topic that you already know. We're going to be talking about period pains because, as we all know, most women struggle with period pains. And sometimes, like, it's a little bit a good thing, like, you can't really talk about it because, yeah, you just can't talk about it really. But it's something that a lot of women struggle with. I did an Insta poll the other day and asked people, like, okay, how many of you struggle with period pains, women? And it was like 70% of the people who answered actually struggle with period pains. And some were like, we don't know what to do. We've tried different things. We just don't know what to do. So I just thought, you know what? Let's do a YouTube video and talk about it. And I've got Ezekiel to kind of share a little bit of knowledge from a medical point of view with us, which I believe will be so essential. So yeah, welcome Ezekiel.
Yeah, thank you for having me here.
Yeah.
Thank you.
So,
Very warming welcome.
welcome. Okay, so should we go straight into it? No, before we go straight into it, I'm just gonna ask, before you became a doctor or studied medicine, whatever, medicine, when you
Yeah.
heard women talking about period, like my periods, that kind of thing, what came to your mind? Or what do you think most guys think when they hear women talking about, oh, I've got a period pain, or yeah?
Well, a very interesting question there. I'll be honest, like before I felt like it's very gross, like it's disgusting, and there's a lot of I think you still remember when we were in high school, like the guys when they used to come to the girls' hostels and then they burn the sanitary pads. Yeah.
Yeah.
Yeah, that was like the interesting part. It was fun in the sense that you're gonna go to the girls' hostels, because you're not allowed to go there. So it was kind of fun. But then the burning part of it was just disgusting. Like I just felt like it's gross. And also like on the part of the pain, I think most guys just feel like it's malingering, hysteria or something. They just don't feel like it's really that painful, because me, honestly, I've never experienced any period pain, but then, I think it's a very important topic to discuss, because a lot of women are actually having serious problems with period pain. So yeah, I'm quite excited to, share the little that I have about period pain with you.
All right, thank you.
Yeah.
That's actually true, because I know, like, when I grew up, it was kind of hard to actually talk about it until I got like into that zone of, you know what, if I've got them, I'm gonna say, of course, not everyone. My family, my brothers and my dad, they had to learn to understand the language, and now it's like a normal conversation. But most times, it's like females are like, oh, maybe I should lie that I've got a headache. Or I should, we come up with these different.
Yeah, you have to come up with something funny.
We come up with weird things other than just saying, it's that time, man. I can't deal with it. So, but anyway, let's go straight into it because of time. I don't want this video to be so long. We've got a lot. Second question is, what causes period pain, or what causes periods, and then what causes period pains? I hope that.
Period cramps or pain, whatever. People just they kind of use them interchangeably, but then it's the same thing. Okay. All right, so basically, initially maybe we want to start looking at the whole reproductive system as a whole, right? Women have it's an orchestra of hormones that play part into the whole menstrual cycle. But then because right now we're just focusing on the period pain, so I'm just gonna explain like what exactly causes the period pain. So we have the ovaries, and then the ovaries are connected to the uterus via the fallopian tube, and then they go to the cervix and then the vaginal canal. So the ovaries, they're responsible for producing a hormone called the hormones actually called progesterone and estrogen. which are responsible for like thickening and enriching the uterus lining, the inner lining, to prepare it for like fertilization. And then towards the end of the period, like if you don't get fertilization, if fertilization does not occur, then basically the body also produces a hormone called prostaglandin. So the prostaglandins, they are responsible for like causing muscle contraction on the uterine cavity, on the utero lining, which impedes the blood flow. It restricts it causes like vasoconstriction, like the blood vessels, they constrict, causing like hypoxia, is like not enough oxygen. Hypoxia is like there won't be enough oxygen supplying the oxygen supply to the uterine lining. So basically it dies and then it shuts off. So the prostaglandins, they cause the muscle contractions, and then that's what causes what we call period pain, or in medical terms we call it dysmenorrhea, dysmenorrhea, or something like that. So yeah, that's basically period pain. So, and because it's a hormone, and you're genetically predisposed to have more of it than someone else. We're all different in our genetic makeups and everything. So some women experience more period pain than others because you have more of that prostaglandin hormone in your body. So you tend to have more severe, either you are genetically predisposed to have more of it, or you're predisposed to be more sensitive, like your receptors, they're more sensitive to, you're producing like exactly the same amount as everyone else, but then you're more sensitive to the hormone. So that will definitely cause severe period pain. Yeah.
Thank you. Yeah, that.
Yeah.
I wouldn't have explained it better, I guess.
You know, it's funny, like right now, I feel so unqualified to be on this position. I feel like you are supposed to teach me more about this then, because I'm a guy, man. I've never actually experienced any period pain. But it's a very fascinating topic because a lot of women really come complaining about it. And you can actually even get to a point where you actually need immediate like medical attention with period pain. So I think it's really important to discuss.
I'm just going to add something to what you've said. So basically, from what you've said, you talked about prostaglandin, estrogen, and all the how it kind of plays a part. Sometimes some women actually end up needing more help. I forgot the word. Actually, like literally having to go to the hospital, like to the doctors and all that.
Yeah.
Finally, like with this, I can never say this word.
Dysmenorrhea.
Dysmenorrhea, there's primary and secondary dysmenorrhea.
Yeah.
Which is basically like it starts from, which is what a lot of women actually have. Like it starts from when you're young. And it causes you like it's not caused by any major condition. It's just something that happens because of the process.
Yeah, that's like the physiological period pain. Yeah.
And yeah, basically like it's caused by uterus muscles which tighten and relax, which end up causing cramps. And then on the other end, secondary dysmenorrhea, it's whereby it's like caused by a condition that affects the uterus or other reproductive organs apparently. E.g. like there's endometriosis, something about fibrosis, uterine fibrosis.
Fibroids.
Guys, it's this video. It usually happens like later on. It usually starts like later on in life, not when you're younger, kind of thing. And starts before a period and lasts like even after the period like is over, kind of thing. So just like a distribution, like if you're listening to this, you're thinking, which one might mine be? It's something to just think about, because I think sometimes we don't really think about. Some people like they start having period pains like later on, they're like, hey, what's going on? It might be just raise a red flag. But yeah, I just thought I should say it out there. And when do you think like one should seek medical help?
Yeah. Actually, on that, before you go further, like on the causes of the severe period pain, maybe do you want to explain like what exactly you mean by endometriosis and the fibroids? And
I think
I told you this could be like a reverse interview because I can't know all the answers. I can't.
video, otherwise this video will be so long. Yeah, basically, I know about endometriosis, not much about
Oh yeah,
fibroids.
there's actually endometriosis, there's adenomyosis, there's fibroids, there's premenstrual syndrome, you can have ovarian cysts, you can, yeah, things like that. They definitely play a part, like things like pelvic inflammatory disease, you know. But then, like, not to throw a lot of jargon, maybe I can try and explain what it means. The endometriosis part is basically your inner like your uterine cavity has three linings, right? The endometrium, which is the one that sheds at the end of the month, like every menstrual cycle, and then there's the myometrium, the perimetrium. So when you have the presence of like the normal uterine cavity tissue in somewhere else other than the uterine cavity, like you have it somewhere else, like maybe the ovaries or in the pelvic cavity, then it's definitely going to cause more severe period pain because you're going to get pain from the uterine cavity plus pain from elsewhere, wherever that tissue is going to be. And then you have adenomyosis, where that endometrial lining, it penetrates into your inner uterine cavity linings, like it penetrates into the myometrium, which is the second lining, is it? So when it penetrates here, you're gonna get more severe pain. And then things like fibroids. Fibroids is just basically a tumor inside like your soft tissue, the soft tissue of the uterine cavity. And then there's cervical, I'm sorry, ovarian cysts. That's like a self-explanatory. Then there's what we call premenstrual syndrome. Premenstrual syndrome is basically when you have it's before menstruation, so it's premenstrual. So when you have things like disorders, like the depression, sorry, things like depression, anxiety, a lot of stress, things like that, things that just they disturb your mental stability and your mental health. You're definitely going to be predisposed to severe period pain. People actually underestimate like the influence that your feelings have on your period pain, like how you feel. Like if you're depressed and all that, you're definitely going to be predisposed to severe period pain. And then also maybe use of intrauterine contraceptive devices, those things, those little things that you guys put inside. I don't know why, but yeah, that's basically some of the things that could be a cause of the secondary dysmenorrhea.
Interesting.
Or secondary dysmenorrhea, definitely.
Thank you. Like I was gonna explain it like, yeah, but not like, yeah. So that's great. Love your input. All right. So I guess like if someone is experiencing those kind of symptoms, like what kind of symptoms would you say, oh my gosh, if you're having these symptoms, you need to seek medical help? Or is it like a matter of if you look at what are the symptoms of primary dysmenorrhea, if it's not any symptom related to that, then maybe go and seek your doctor, kind of thing?
I think when you're supposed to seek medical help, maybe initially you might want to try like home remedies first, like before you want to seek medical. But then when you actually try them and then you don't see any change, then you might want to definitely seek. There's no reason not to go see a doctor. But they're definitely like red flags to say, I think this might be a pathological type of period pain. Because there's the normal one. Because I think you say 70 to 80%, is it? Like of women have period pain, like primary, dysmenorrhea.
I don't really know. I've been seeing different.
All right, I think about it should be about 80% of women. They definitely report that they've had period pain before. And then I think about all right, I'm trying to recall, about 20% actually have very severe period pain, where you actually have like you have to miss school, or you have to miss work, or you have to go to the hospital, things like that. And I think about 43% report that they have period pain every single month, despite it being severe or mild, but then they do have that period pain every single month. So things like they're definitely like red flags where you want to definitely seek medical help. Like if you're having normal periods the whole time, normal period pain, and then it gets like more and more severe within, like, let's say 2 to 3 months, like suddenly you just experience more severe pain. Yeah, you definitely want to seek medical help. Or maybe when your period pain is not relieved by the medication, like what I said. Or all right, so I was saying, like, maybe when you have period pain, like that has been progressively getting more and more severe. Within, like, let's say 2 to 3 months, you have normal periods like the whole time, and then for the past 2 to 3 months, they'll be getting more and more serious. Then definitely you might want to seek medical help. If you experience pain when you're not on your periods, yeah, that could also be like the period pain, but you're not on your periods. That could be a red flag. And then when you're older than 25 and you experience severe period pain for the first time, because age plays an important role, like in this aspect, then you might want to go to see a doctor. And then when you also have like a fever, which is associated with the period pain, then it could be a sign of severe, maybe some infection, like what I was saying, the pelvic inflammatory disease. You could have like because it develops as an STI, and then it ascends into the reproductive system, the uterus, and then the ovaries, the fallopian tubes, and that definitely could cause severe period pain. So you might want to see a doctor if you have a fever associated with it. Then sometimes, like, you might have like heavy vaginal bleeding associated with the pain. That could also be a sign that you need to see a doctor, because you could progress to even losing too much blood, and then you can even faint. And when it's associated with maybe even loss of consciousness, sudden chest pain, things like that, you have other associating symptoms with the period pain. That could be a red flag. Then you may say, I need to go and see a doctor, particularly a gynecologist. You need to go see a doctor.
Oh, that's literally interesting. Like, yeah, so guys, if you're out there and you're not seeing any of these symptoms, then you need to see your doctor. But this is not, we're not literally like here to tell you what to do, but it's just like advice. But you still need to see your own doctor. Anyway, so there are different methods of relieving the pain. Let's say if you've got primary dysmenorrhea, or you want to see if or you want to eliminate primary dysmenorrhea, then it's best. I think it's best to kind of try these different methods, suggestions, which research has shown that they actually work. The first one would be something I know a lot of women, especially in England, I don't know like other countries if they use this, but it's like a hot water bottle. There are pros to hot water bottles and there are cons to hot water bottles. Like the pros are, okay, short term, it gives you relief, you feel better, that kind of thing. But I think there's something that a lot of people don't say. Like most of the time, if you use a hot water bottle like this without anything on top, then it actually might end up causing this condition, skin condition called erythema, whereby your skin starts like
Eczema.
no, not eczema, erythema.
Erythema. Okay.
Erythema. Yeah, that one.
Yeah. No, you can explain. It's okay.
Like whereby your skin, like at first it just starts like, oh, it's a little bit change of color, and then it might end up like darker and darker, and then ends up being black or permanent marks. And I know a lot of women that you don't want to end up having those marks on your body, especially if you grew up like naughty and child free like me, and acquiring a lot of marks when you were young. I don't think you'd want to add more marks on your body. So it's something to kind of keep an eye on. If you're going to use a hot water bottle, make sure you use it on top of something like a cloth or something like that. Don't use it directly. Yeah, it might cause more damage long term. And if arrhythmia is not treated, like if you keep on using it, it might actually long term cause cancer. And I think no one wants that. Yeah, you want to relieve periods, but you don't want to cause more problems to your body. So it's something to keep an eye on. Another
Yeah,
thing,
just to add on. Oh yeah, you're still talking about the cons and the pros.
I finished, I was going to go on second thing. Yeah.
Oh yeah, and the hot water bottle as well. Like when you're gonna use, because you use it to maybe a temperature of maybe about 38 degrees. I don't know, slightly just above the body temperature. But then it's quite difficult to moderate that temperature. So some people can actually use it when it's too hot, and then it bursts, and then you have like scalding, hot water on your body, and you actually get burns. And yeah, that's another disadvantage. But then the one that I really think is interesting is, like, when you're using the hot water bottle, like it heats your muscles and the fascia. Fascia is like the connective tissue that connects between that connects your muscle and the connective tissue that connects your muscles. So when you heat that connective tissue, it softens, and then when it gets cold, it hardens, right? So the next time maybe you're trying to relieve those period pains with a hot water bottle, you're probably going to have to use a little bit of a higher temperature to get the same amount of relief that you had the last time. So you end up using water and water and water, and it gets more dangerous, because the next thing is you're gonna get burned.
Mm.
So it's advisable, like, to try other methods apart from the hot water bottle
Yep, yep.
before you resort to it.
Good point. I once read that in a research, but I literally forgot about it. So.
You're the one who should be schooling me, but then
Yeah,
you're the one who should be schooling me.
but all right.
I'm actually wondering what I'm doing here, because I've never experienced any of this
What are you
in my that I'm here.
diet? And if you know me, you know I'm a strong believer in diet, lifestyle, and all that jazz. Like, yeah. And with diet, like literally, I was gonna go in depth, but yeah, I'm just gonna do a snippet. Otherwise, I'll bore you guys, and that's not what I want to do. That's not what you want. So basically, naturally, it like there's this thing called inflammation in the body, and I want you guys to go and research. So basically, I thought you something. Um, so basically, when it comes to the way the immune system works, the immune system is there to kind of fight for our body when we are in pain. Like, it will send white blood cells to say, okay, you know what, we need to heal, that kind of thing. When we are going through something, like the immune system, like, is there to do that. And something that actually distracts the immune system is inflammation in the body. And that's something I want you guys to go and research a bit more into, because I think when you research it, it just makes it a bit more, it makes sense a little bit more. The way inflammation works, it's like it kind of reduces the way your immune system works. And yeah, basically, there's a link between inflammation and prostaglandins, which we
Prostaglandins.
prostaglandins, which you kind of spoke about when the video started. And yeah, can
Yeah.
you explain a little bit on how that links, the link, but in normal language?
Okay. Basically, to make it simple, prostaglandins, like, apart from causing uterine contraction, they play a part in pain and inflammation in the whole body. So when you uh, when you eat foods that are pro-inflammatory, you're actually going to increase your prostaglandins through a pathway they call the cyclooxygenase pathway, and then yeah, there's going to be way more prostaglandins, and then that's going to predispose you to definitely more severe period pain.
And on that note, like basically naturally eating foods that decrease inflammation in the body will help to tame period pains.
Yeah.
Foods like foods that actually reduce inflammation are foods like fruits, vegetables, whole grains, legumes, nuts, seeds, and all that. And even research has kind of shown that eating more plant-based foods or a vegetarian diet is literally like helps to reduce inflammation in the body. So if you're someone who's like really struggling with it, maybe it's something to try, or you could try it a week or 2 weeks before your periods when inflammation is like kind of high in the body. So maybe that's the time like to actually reduce like foods like that have like that increase inflammation. Foods like meat, especially red meat, um, sugar. There is meat, sugar, red meat. Well, like I just went blank. Oil and refined foods. Like literally, that's the time to reduce it. But I know a lot of people are gonna be like, "How?" Because a week before my period, that's when I'm craving all these things. I'm craving chocolate. And that's the truth. The battle is real. Like literally, I have to discipline. I know, like when I'm about to have them, I'm like, I start craving everything that I never crave, and it's like the same. That's literally the same time. Like that's the time I literally force myself to be disciplined because I'm like, no, if I have it, I know what's gonna happen next week. I'm gonna be dying. So like, it's something to just think about. And there is literally a connection between the foods you eat and your body's estrogen levels because like animal products and added oils increase the levels of estrogen in the body. And the more estrogen-based foods one consumes, the more likely the uterine lining, which we spoke about when we started, becomes abnormally thick. As a result, that will end up when it begins to break down during the menstrual cycle. This process may end up increasing the prostaglandins.
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 I'm sorry. I'm sorry.
I'm laughing at myself, so it's okay. So it's something like if you're thinking about like, oh my gosh, what do I eat? Just try and reduce foods that increase inflammation, and increase foods that actually decrease inflammation. Yeah, do your research. And yeah, so that's literally it on diet. I'm not going to tell you what to eat or what not to eat, but I've just given you like a guideline: decrease inflammation, increase foods that decrease inflammation. Yeah, and that's it. And then when it comes to supplements, this is the big one that I like. Like personally, I've started using. I did a research on it like a few years ago, and then last year I started using these supplements, and I've found these supplements like they literally helped me a lot. So the first supplement I was using is zinc, because with zinc, oh my gosh, zinc helps different things. It's really good for different things. But right now we're focusing on periods. So zinc like reduces infertility. Oh, that's nothing to do with periods. Sorry. Women and progesterone effectively, like the hormone. It's also an antioxidant and anti-inflammatory property. So it kind of helps like the blood flow in the body. It reduces inflammation, remember, and also like because it reduces, like increases the blood flow and all that, like it then helps the blood and oxygen to actually work better and reach the uterus and prevent cramps. So I think it's something to just include in the diet. It could be through supplements or try to eat foods that have zinc in them. But if you're vegetarian, then you're probably not going to be able to have enough zinc. So you might need a supplement, something to just think about. And then another supplement, I'm just going to give a few, like, yeah, two more. And yeah, you could do a bit more research into it. Another supplement that I found really, really good. It's hard to find though. Actually, you can find it in a lot of like shops, but it's just one of those. Royal jelly. I remember when I saw the name, I was like, what is that? What?
Yeah, what is royal jelly? I don't even know what it is.
Royal jelly is like, it comes from honey, like bees kind of thing.
Mhm.
Yeah, research, guys. And it helps reduce inflammation and restrain, and it also restrains bacteria, like restraining bacteria kind of thing in the body. It's really good with people with anemia. If you're anemic, this might be good for you, especially like if you're anemic, you're probably not that. During your periods, you lose a lot of iron. So this might be really good for you to kind of balance your iron levels during that time. And it also contains antioxidants, which are really good in fighting inflammation. And it may provide relief from premenstrual syndrome. So it's better to take it like just before you start your periods, so that when you start your periods, like the cramps are already reduced, and then that pain before, like it can also be reduced. And the last one, I will actually, I don't have enough evidence about this one, so I won't talk about it. Sorry. But basically, the other thing that I found really useful for me is ginger. Literally, it's not a supplement, but I use it like as a tea. Like I enjoy, like, oh yeah, the last one is teas. Like teas are really good, especially teas with like berries and all that, raspberry and all that. Because apparently, like example, raspberry tea, it actually decreases bloating and pelvic muscle pressure. So, and I know a lot of people like they're like, oh my gosh, I'm bloating and all that, like just before or during, and something a lot of people are just like, I don't want that feeling. So maybe just drink a lot of teas, herbal teas, and find relief that way. And one of my favorite tea, especially just before and during and after, like, is ginger. I'll literally just take ginger on its own, chew it and drink it, or I will boil ginger, literally like put it on the stove, boil it, and then drink it with honey or whatever. I find that it just helps. And when you look at ginger, like it helps relieve um, pain and nausea. And some people, like with primary dysmenorrhea, they find like they're feeling like, oh my gosh, I feel nausea, I feel sick, but nothing is coming out. Or some people actually something comes out. So maybe it's the time to actually have more ginger in your diet. And ginger also helps less bloating.
No, ginger pretty much helps everything, like
Yeah,
anything.
literally everything. It's a bit
Yeah.
like, Lord, like, how did you create ginger? Ginger and garlic, like, whew, sorry for another day. So I think
Yeah.
main supplements I would like encourage to kind of think about. And also a side note, if you're gonna end up doing like a vegetarian diet, you might need to like have supplements, like research about it, like iron supplements, because for me, I remember when, because I became a vegetarian, I was like, oh man, I need to become vegetarian for a while. And it helped with my period pains, like they reduced. Whenever I eat meat, like they'll go up that month. Whenever I eat sugary food, they'll go up that month. So I just like, oh, nah, stay away. And then, yeah, that kind of thing. But it ended up causing me anemia because I wasn't having enough iron in my diet, or maybe I was just not eating properly, like healthy. So if you're gonna end up being vegetarian, just make sure that you're still having all the nutrients in your diet through the foods. Just be more mindful. Otherwise, it might end up causing more harm than good. Something to think about. Um, and yeah, now so sometimes people are like, okay, I've tried it all. What else can I do? And then this is where medication can come into play. But I'll ask, is it okay to talk about the medication bit? And then I'll add.
Oh, I don't think there's much to talk about the medication. Basically, you just need, as you were saying, like you just need anti-inflammatory drugs. So you use like a non-steroidal, they call them NSAIDs, non-steroidal anti-inflammatory drugs, like no, ibuprofen. I think is one of the most common. You can use naproxen. You can use acetaminophen. Acetaminophen is basically paracetamol. And but then like paracetamol is less effective than the other one, so you might want to try other NSAIDs before you try paracetamol. And yeah, I think that's basically it. You know, they're basically over the counter, so you don't need any prescription. You just go and then you just tell them I have period pains, and then in any local pharmacy, and then yeah, you just buy them, and that's it.
Mm. And adding on that, from what I learned personally, like I think when you take or what's it called, NSAIDs, like painkillers,
NSAIDs, yeah.
whichever one you end up taking, just make sure that you stay on top of them. So if they say not more than 8, try and figure out, okay, not more than 8, how can I have them, like space them out so that you're having like at least 7 or 8 in that day. So
Yeah, true.
morning, just start a day before your period start, 2 in the morning, 2 like after 4 hours up, and then make sure that it's like auto routine so that even when they start, you are on top of, you're ahead of the pain, other than waiting until the pain comes. Then it's like it'll just be like, oh, it's too late now. The painkillers will be like, oh, you have to give me a half-life of 30 minutes or an hour. So you got an hour until your medication actually kicks in. But if you're on top of the medication, then like literally it will help you control the pain throughout. Something to just think about. And yeah, last one is exercise. A lot of people are like, oh no, I don't know, I can't exercise. No,
A lot of people don't like that one.
am I crazy? Why would I exercise? Like, no, it just doesn't. And to be honest, I'm one of those people. It's like, what am I doing? But I've found that when I exercise, it shouldn't be like extenuous exercise, because if you do extenuous exercise during that time, most of the times, like our body, because like our hormones are all over the place, like there's a change in hormones, our joints and tendons, like
Tendons, yeah.
they'll be at greater risk of damage, of injuries during that time. So it's probably not the time to go all crazy to say, oh, pain, no gain. It's not the time. But it's probably the time to kind of do like some stretch workouts or just do a brisk walk, 10 to 30 minutes, that kind of thing, or just find a way to make sure that area, at least it exercises, it stretches, but without too much. Because when you do it that way, it's kind of increasing your the hormones. I know these hormones are endorphin hormones, which will kind of make you feel good. Like, because most people are like, oh my gosh, I need to feel good, so they end up going to chocolate, which is going to increase inflammation. And cause them to actually cry later. And it's like, why? So if you want to feel good, maybe go for a walk or do a little bit of an exercise that's not too much, or a strength workout, because apparently strength workouts, like not too much at the same time, just a little bit. We can, like, they work better during that time. I don't know how the hormones work, the body works, but just look for something that you enjoy. Don't do too much. Just do a little bit so that you have those endorphin hormones, they go up, and then you just feel better. And it also kind of helps relieve the pain a little bit. So something to just think as we continue this journey. Yeah, I don't know if you have anything to add before I got to the last one.
I just wanted to add, like, you know, you're talking about endorphins. That's what we're talking about, like premenstrual syndrome. It's actually it's a real disease. It's an actual disease, the disorder. So it helps with that, because premenstrual syndrome is like a combination of like emotional, physical, psychological, just like things that happen to you between ovulation to the time when you start menstruation. Yeah, if anything like depresses you, you have a lot of anxiety, whatever. Yeah, you're probably gonna be more prone to have the period pain. So those endorphins, they're quite important. You know, something like yoga, meditation. You know, just relaxing your brain. Yeah, it's gonna help you to, you know, it will relieve you from that. And then also smoking and alcohol. I know you don't smoke, you don't drink, but then yeah, you never know. Yeah, smoking and alcohol, and probably getting enough rest, it's gonna help you a lot with
Smoking
the
and
period pain.
alcohol will help.
Like, no, I'm saying not smoking
Okay.
and not, you know what I'm talking about. Like avoiding smoking and alcohol. No, I mean like.
Yeah. So guys, I think you've got all the tips that literally can help. You can take one or two or a combination of the things that we've said, or try everything. And if everything doesn't work, then maybe you actually, not maybe, then you actually need to see the doctor and get it checked, because it might be something big, and it's better to get it checked soon than later when you want to have kids and then you actually cannot have kids anymore because of something that could have been prevented long back. And the last thing that I found works magic, it's literally like magic, it's patches.
Yeah, now you're giving us personal tips. That's what we wanted. We need those personal tips. Tell us.
This patch, oh my god, this is a miracle. I don't know, because okay, this is the thing with me. Like when I was like in my whole journey of experimenting what works, what doesn't work, I realized, okay, eliminate sugar, eliminate meat, eliminate, but it's hard, man. Like, okay, it's hard. It's hard. Like we can do it, but sometimes like you go to someone's house and then all they have is refined. You don't want to be like that person. Personally, some people don't mind, but personally, I didn't want to be that person who becomes a burden to people. That kind of thing. So it was like, okay, I need to find other ways so that I'm like when I can do my lifestyle, but when I go out, I want to be able to just eat, like, and not think about what's on the menu. Nah, I can't have chips. I can't, like me, when I go out, you know me, like I will eat anything that is forbidden. I would just eat it. So like it was like I need to find a way to balance it out. And so that's when I started like the whole supplements. And the supplements, I realized they worked, especially when I did them just around my monthly cycle, and I changed my diet fully to vegan, healthy diet during my cycle. It was like good. And then sometimes I'm like, okay, we can have eggs, we can have that kind of thing. And then when it's that time, now we're strict, that kind of thing. That worked for me. It didn't eliminate it, but it helped a lot. And then when I started exercising as well, it was like, whew, okay, it works better. It literally, the pain was like reduced, not eliminated, but really reduced. And I was like, okay, you know what, I've got this now. Like, yeah, I no longer miss school or whatever because I can't bear it, that kind of thing. And then I saw this on someone's Snapchat. I'm not here advertising for them. I'm not getting any money from this. I'm just sharing what worked for me. I saw this a few months ago. I was like, okay, let me try it. So basically, it's like a patch. I tried different patches before and they didn't work. It's literally like a patch that you just.
Am I supposed to still be here, or should I mute myself? And
no, yeah, it's not anything like that.
Because okay.
On your hand or wherever, like you feel the pain, and once you do that, trust me, it works.
Oh, okay.
Really worked. I was like, what is going on? Why am I not feeling any pain? Like, I was shocked. Like, I was so shocked. And so, yeah, it's called BU. If you've never tried it.
Wait, what does the patch contain?
So it contains natural ingredients. That's what it says. And it lasts for 12 hours. So you can usually put it for 12 hours, go to work, do whatever, come back, remove it. And then after 12 hours, it doesn't work. So, and then put another one. So literally, and they're like 5 in a pack. So you can have that for like 3 days and you'll be good. So go to work, come back, go to uni, come back, do whatever you want. Like, I would recommend it's natural ingredients, vegan, but to be honest, I don't know what exactly ingredients are there. They don't show. Yeah, it's a business, of course, but it smells like peppermint and different things. Sometimes it's like got a cooling effect, and then it's normal, and then cooling effect, and then it's normal. But yeah, so guys, I've given you all the tips, and I hope something works. If nothing works, go see your doctor. That's literally all for the day.
No, wait. I want to do a reverse interview now.
Okay.
I want to ask you questions.
Oh
No, it's nothing. It's nothing serious. It's just a question. Just one question. Like this is like from a guy's perspective. Like nothing to do with like the medical and whatever. But if you were probably my girlfriend and you're on your periods, what exactly do you want me? Because you guys, you act funny.
Leave us
So
alone.
what exactly? Like yeah, there's a lot of mood swings and a lot of things going on. So if I was probably your boyfriend, right, and you're on your periods and you have all those mood swings, what exactly would you want me to do for you?
I don't think any girl knows.
So what am I supposed to do?
Girls, if you know, please send comments below. I actually don't.
Okay, fine. If you know, like, just comment, like, comment, and subscribe. Tell us like exactly what we're supposed to do, like, because we also have absolutely no idea,
I think
like
just
what are we supposed to do?
leave us alone. The thing is, it depends.
Like, leave me alone. Why are you not answering my calls?
Nah,
What the hell?
no,
And like,
okay, it's that time. Like, of course, it should be like open communication in it. So you just know, okay, it's that.
oh,
And then I think sometimes I don't want to like open up too much to you, but basically, like I know myself. Like sometimes, like I just don't want to talk to anyone, so I'll just ignore all the messages in the world. Like, yeah, and just focus on one thing. If I have uni work, that's all up to uni work. I don't want to do anything. I just want to go for my walk, listen to music, and not do anything. And then there's certain times I'm just like, oh man, I just want to like I think it's different. I don't know the answer. I'm sorry, guys. I just don't know the answer to that question. Yeah.
okay.
So guys,
Yeah, that was what, that was probably my only question.
guys, I could do and guys, if there's a guy,
Yeah, because the things like the mood swings are actually legit. Because there are those myths, like the misconceptions about period pain, like the pain is not real, like you can like you can dismiss your feelings and whatever. And, it's just a myth because the pain is actually legit real, and then the depression and the anxiety is real, and the mood swings are real. Just because it happens like monthly, we can't really invalidate the fact that you're actually depressed, at that particular moment. But then, what are we supposed to do? Like I'm just asking it from a guy's perspective. I don't even know, because at the end of the day, you just end up being like, okay. But anyway, if you're watching this video, then please comment, like and comment. Just tell us like, what are we supposed to do?
yeah.
Should we leave you alone? Should we buy you chocolate? I'm sure there are gonna be some people will be like, yeah, take me out.
Even if she wants chocolate, buy her fruits, buy her strawberries, buy her food that will increase.
You want fruits. You want fruits.
No, but wants to be healthy, not making her feel better, or she might think she's
Yeah.
it's not really feeling better. Buy her fruits.
Yeah.
You're gonna blame me for this, but guys, I'm saying buy her fruits. Yeah, and she can come for me later. Buy her fruits. That's all you can do. Anyway, it was nice having you, Ezekiel, in our midst.
Yeah.
Guys, thanks for watching this. If you know anyone who struggles with this, which is almost everyone, if it's your auntie, your mom, your grandmom, your ex-girlfriend, your girlfriend, your sister, whoever, just share it with them and comment, because I want to know what you guys think. Like this year, I want to interact with you. I will reply the messages. And yeah, until next time, guys,